Welcome to the Rise Above Project. I'm your host, Joe Perroni. I am a licensed marriage and family therapist, champion bodybuilder, and I've been a personal trainer for about 30 years. This podcast is about helping people with their emotional, spiritual, and physical fitness. I value strength, toughness, and truth. I despise complacency, the victim mentality, and following the herd. If you find my work to be valuable, please subscribe to my channel and tell a friend.
The title for today's show is Trauma and Relationships Are Connected. I decided to do this show because I found myself in an interesting conversation the other day. I was talking to a colleague about therapists who specialize in trauma therapy. One aspect that was a point of contention for me was that many trauma therapists refer their clients out to other therapists for their relationship difficulties. On the surface, this doesn't seem to be a breach in the standard of care. It is within the rights of each therapist to work only within the scope that he or she is comfortable with, and with only the population that they prefer. However, I do find it very intriguing that some trauma therapists don't want to address a traumatized person's relationship with their significant others, and they also tend to shy away from doing couples therapy. It is my professional and personal experience that you cannot explore an individual's trauma without understanding their perceived relationship with themselves, with their loved ones, and with their world. Almost all emotional trauma is a result of early dysfunctional relationships and attachments, which delay and corrupt the developmental process. Personally, I hate the idea of labeling people, but it is expected and it's mandatory in the mental health field if you are working with insurance companies. I believe all symptoms of trauma are explainable, and they exist because of the individual's subjective experiences within his or her environment. I do not believe in disorders. I do believe in stress responses. To be clear, I treat the human being, not a diagnosis. However, for today's show, I will use the standard DSM terms so people will understand what I am referring to. The traits and/or symptoms of complex PTSD or from cluster B personality disorders, such as borderline personality disorder, they are not clandestine conditions. They are directly intertwined with the individual's relationships, attachments, and interactions with the external world. Dysfunctions in these areas create developmental deficiencies, which create flaws in the individual being able to perceive reality and to appropriately cope with stress. By the time someone is in an office asking for help, there is and there has been a circular relationship between their trauma and their relationships, meaning they are traumatized due to their earlier experiences, which negatively affects their current personal relationships. And their current personal relationships continue to cause or trigger emotional flashbacks. The triggers from a relationship can occur whether the relationship is toxic or not. Paradoxically, many people with unresolved trauma are triggered by being treated well. There are various complex moving parts in the scenario that I described, but it is safe and it's prudent to assert that trying to decrease trauma symptoms without addressing relationship and environmental realities, which may be regularly exacerbating and supporting these symptoms, is not the most helpful strategy. It is extremely difficult for therapists to find the correct balance between validation and empowerment for their clients. Clients with unresolved trauma are extremely sensitive to any language that they may determine to be judgmental or critical, and that could destroy trust. Gaining trust with the client is difficult, but it's a necessity if meaningful changes are going to take place. Suggesting a client to start over again with another therapist after you have gained their trust is a recipe to traumatize them again. It feels like abandonment. And this is another reason why I am against referring a client out to another therapist when they need you the most. There has been plenty of empirical evidence that indicates that the therapeutic alliance is the most important aspect of treatment. In attempting to maintain this alliance, too many therapists are hesitant to challenge their clients. When treating those with complex PTSD and those with borderline traits, it is imperative to use compassionate inquiry while simultaneously challenging their perceptions, thinking errors, and actions. This is especially important when working with individuals who are plagued by unresolved trauma issues. And with due care and respect for those suffering with these issues, I will explain why. All children are born into this world naked, needy, and dependent. They seek a secure attachment with their caregivers to take care of all their needs. If their needs are met, then the child will reliably develop and meet their expected age-appropriate milestones. According to Erik Erikson's psychosocial development theory, children pass through the trust versus mistrust stage, the autonomy versus shame and doubt stage, and the initiative versus guilt stages from birth to 3 years old. And there are 5 other stages, but for today's talk, let's just go with the first 3. If children successfully develop through these stages, they will have the ability to trust others, they will increase their self-esteem to help them become more independent, and they will have the initiative to perform tasks and take responsibility for their life. It is a paradoxical fact that if a child is supported and is securely attached to their caregivers, he or she will be able to be curious, explorative, and seek independence. If there is a breach in connection, or the child is neglected or invalidated, he or she will have developmental delays. Not only will they not get their needs met, but they don't have enough cognitive maturity to even understand or have a desire to meet their own needs. As they grow into adulthood, he or she may be extremely traumatized just by the thought of meeting their own needs, and they will continue the search for others to meet their needs and to be responsible for their feelings. As Freud discussed in his theory of repetition compulsion, people who have not had their needs met in the stages where the young child had no desire to meet their own needs will repeatedly seek other people and situations to make them happy and to meet their needs to correct the transgressions of their past. Consciously or unconsciously, they blame the people in their life for their unhappiness, and they have difficulty taking responsibility for their own life. Many unfortunate people who have unresolved trauma issues look at the world through a lens that makes it very difficult for them to perceive and navigate reality. And to a great extent, they are motivated by their feelings first. If they feel angry or if they feel depressed, they tend to tell themselves a narrative that supports their feelings, regardless of the actual facts. Thus, many actions are based on emotional dysregulation, immaturity, and soothing is sought and expected from external sources. Those with unresolved trauma tend to see situations and people in black and white. People are either all good or all bad, and this is known as splitting. When a person with BPD traits splits, they are trying to decrease their inner pain. Their inner critic causes them intense emotional pain. When they hit their threshold, they turn their inner critic into an outer critic. It is easier to cause pain than it is to accept their own pain. So therefore, they will project their pain and criticism onto their partner or who's ever closest. The level of their rage and criticism tends to be far out of proportion to the situation. It has been said that BPDs can love very intensely, but they can also hate just as intensely. Their anger leads to a self-fulfilling prophecy. When the symptoms of anger and rage are directed at people without cause, it confuses them, and they tend to distance themselves from further potential conflicts. In addition, if an individual can't distance themselves from a person with borderline traits, they must be very cautious of everything they say in order to not cause a rage reaction. And this causes further alienation. The book Stop Walking on Eggshells will give you more insight about this. Ironically, when a person with borderline traits alienates people due to their anger, they typically get angry at those who distance themselves. Furthermore, they don't have the self-esteem and the insight to take any responsibility for starting the chain of events. And due to fear of abandonment and its opposite, fear of engulfment, their relationships tend to be very turbulent. Within a short amount of time, sometimes within minutes, a person can be idealized and then devalued and demonized. Many people with unresolved trauma live with persistent anxiety issues. To alleviate some of this anxiety, they may turn to obsessive compulsive behaviors. They may also feel out of control and empty inside, and this leads them to need control over their partners. When their partner gives in, they will feel loved. But if their partner has their own boundaries or preferences, then the traumatized person may act out with anger and rage. Having a reciprocal conversation where both partners are seen and heard is difficult because they may falsely believe their partner is trying to manipulate them. This thought process is informed by their assessment that people are generally malevolent and untrustworthy. According to the DSM-5, traumatized people with borderline traits may fear abandonment and rejection, have intense relationships, have identity disturbance, impulsivity, suicidal ideation and self-harm, affective instability, feelings of emptiness, intense anger, and paranoid ideation. Evidence suggests that people with borderline traits are empathetic and are good at reading other people's feelings. Unfortunately, they misinterpret these feelings and come to the conclusion that other people are trying to hurt or take something from them. And this type of thinking is informed by their jealousy, their envy, and rage. A traumatized person who appears to meet the criteria for borderline personality disorder or complex PTSD, which complex PTSD is not in the DSM-5 at this time, these people should seek treatment. However, it is my clinical experience that oftentimes they don't go to treatment to take responsibility for their thoughts, emotions, and behaviors. It's been my experience that they try to find justifications for their emotions and actions, and they attempt to have the therapist validate their experience, even if their experiences are not rooted in reality. It may be easier for a trauma therapist to refer a traumatized client to a couples therapist if they want to work on their relationship, but it's at the very least lazy, and at the most, it's counterproductive. Many therapists who have unresolved trauma and borderline traits themselves, they've dealt with their issues by professionally helping others and by swearing off their own personal relationships. Instead of meeting their own unmet needs, which have been blocked since early childhood, they seek to meet these needs through external validation and appreciation from others in relationships with a power differential. It's a strategy of avoiding the deeper core issue, and it can definitely hurt their clients. Clients with unresolved trauma issues who are causing pain and dysfunction in their life in general and specifically within their significant others around them, they do need to seek individual and couples counseling. And it's my opinion that the same therapist should be utilized for each. It is possible to be in the presence of a person with unresolved trauma issues for many years and never see the symptoms that cause them and others pain. And this is because the symptoms may only present within the context of an important relationship, such as those with a spouse or a parent. They can live somewhat symptom-free in transactional or acquaintance type of relationships. Empirical evidence also indicates that people with borderline traits are not insightful. So this is from a conclusion from the Journal of Psychopathology. And this is their quote, it's not mine. Quote, patients with BPD have a decreased level of insight into the absurdity of their obsessive ideas, are unable to cope with their thoughts, and do not recognize the abnormality of their compulsive behaviors. These features are the expressions of a deficient sense of self, distance from reality, and a lack of coping skills, unquote. So here's my question. If a person with these features goes to a therapist, what are the chances that they are giving an accurate portrayal of the relationship that they are in? The answer is fairly close to zero. So now we have multiple problems with a trauma therapist referring a client out for couples therapy. Number one, the client's symptoms usually only appear within the context of a relationship, which obviously can't be observed without their partner, although the therapist can gain some insight from the therapeutic alliance. Number two, the client does not have the insight to accurately portray the situation, which leads the therapist on a wild goose chase. Number three, you don't have the luxury of the other partner's perspective, which makes it extremely difficult, if not impossible, to determine if the current symptoms are being caused by a dysfunctional relationship or the relationship is becoming dysfunctional due to unresolved issues not being properly dealt with in the present time. And number four, I feel that a therapist can be most useful for a client if they are in their presence during a typical disagreement with a significant other. It is during this time that the therapist can experience the conflict in real time and therefore has the best chance of intervening in a way that can offer insight into the conflict and to be able to suggest conflict reducing strategies. Treating clients' trauma issues without fully addressing their current relationships does a disservice to them. It's the equivalent of trying to tune up a car without ever taking it for a test drive to determine how the car performs in traffic at normal speed. People must be given tools to have healthy attachments and connections and to remain emotionally stable during times of interpersonal conflict. I hope you found today's show to be interesting. I am Joseph Perroni from the Rise Above Project. Please subscribe and tell a friend. Thank you.